Our mission as a society over the last 15 years is very simple. It's to provide current and relevant information regarding seniors housing, health, resources, and supports that will contribute to successful aging. It's very straightforward. We want to share information with you so that you yourself as an older adult and an individual can make informed choices. As we grow older, many challenges will take place, and we want you to have a positive experience as you transition through different phases in your life. But overall, everybody's quality of life is different, and we want you to be able to embrace change with knowledge, planning, and research. Before we begin, I would like to start, as I always do, with a message of acknowledgement. In the spirit of reconciliation, we acknowledge that we live, work, and play on traditional lands of the Blackfoot Confederacy, Tsuut'ina and Nakota Nation, and the Métis Nation Region 3, and all the people who make their home within Treaty 7 lands. By acknowledging our authentic Canadian history and its original people, we are telling the story of our country and this region. Together, our communities are stronger when we understand our Canadian history, and we can build a future together. Also, I'd like to thank our platinum sponsor, All Seniors Care, who has been with us for over 5 years. Also, United Active Living, who has been a sponsor and a supporter since our inception. We also would like to thank Covenant Living, Evanston Summit, and Alberta Securities Commission. It's a good time to pause about what is a sponsor. I want all our listeners to understand that our sponsors give us funds so that we can have webinars and have our inserts in the Calgary Herald 6 times a year. However, they have absolutely no influence over what we say, the speakers that we invite, and their only concern is that, like us, seniors have information so that they can make informed choices. So we humbly thank them and are so pleased that they continue to support us. You're going to be able to ask questions. So please make sure that you're able to use your chat function. And we will have a board member who will be monitoring this. And at the end of Betty's presentation, she will be able to answer some questions for you. I'd like to take this time now to welcome Betty. She is a pharmacist, an instructor at SAIT, and a local business owner. So thank you, Betty, so much for joining us this evening, and I'll turn it over to you.
Thank you so much, Kathy, and I'm really happy that everybody came out for what looks like a very nice fall evening. And I'm just getting my presentation up here for you. So I'm asked to share my video so that you can see my eyes dancing around the page going, where do I put all this stuff? There we go. All righty. So thank you for having me this evening, and hopefully there's some questions that you guys are curious about influenza, which I'm going to be speaking predominantly on, but can also talk about other immunizations. I've included a presenter disclosure. I do a lot of presenting on vaccinations, and I've worked with the Alberta Pharmacists Association, the Canadian Pharmacists Association, GlaxoSmithKline, Merck Canada, Pfizer, Sanofi Pasteur, and Valneva, which kind of covers off all of the different vaccine companies we have in Canada. And this evening, I will be getting an honorarium from Sanofi Pasteur, and it's really a delight to have you guys here, and let's go. So learning objectives, we're going to look at influenza. Is it more than just a cold? We also want to look at the burden of influenza in older adults, vaccine safety, efficacy, and multiple vaccines. And of course, there's changes in the pharmacy. So what is it going to look like getting your flu shot this season in the pandemic of COVID-19? So influenza is more than just a cold, and I'm going to go through some of the signs and symptoms of colds versus influenza and also look at some myths versus facts. So this first slide here, it's got some fairly common symptoms, and the ones that I will really key in on when I've got a patient that's asking me, you know, is it a cold or is it flu? And the really big ones are fever, headache, and body aches. So if you guys have ever had everybody's had a cold. Flu is very much different. It's an achy feeling in your body. And oftentimes you're couch ridden or worse. And influenza has some consequences as well. Most people recover in a fairly short period of time, but people can get worse symptoms, like things can go on to get a viral pneumonia or a bacterial pneumonia, and there can be worsening of chronic conditions, and it can even be obviously life-threatening. So some of the flu myths and some flu facts, I'll just read through them. One myth, the flu shot can give me the flu. That is a myth. Flu viruses are used in the flu shots are inactivated, so they cannot cause the infection. You may feel a little under the weather for 1 or 2 days post a flu shot, but that is just your antibodies getting generated in your body. So you're not going to get the flu from the flu shot. Also, flu shots can take a couple of weeks to really work. So if you get a flu, within 10 or 14 days after you get a flu shot, you likely had the virus prior to getting the flu vaccine. So another myth, vaccines are not proven to prevent the flu. If you get the flu vaccine, you're about 60% less likely to need treatment for the flu. Another myth, I should wait to get a vaccination so that I'm covered through the entire season or to the end of the season. And actually, you should get your flu shot as soon as possible. Our flu program in Alberta starts on October 19th, but I am going to be talking about a different flu vaccine that would be a recommendation for anybody who's over 65. Is it better to get the flu than the flu vaccine? No. Prevention of the illness is really important. And as we'll see in some of the slides, that the flu can actually impact people's health in the short term, but also in the long term. So it's really important to get vaccinated against the flu, and prevention of disease is key. And I think some of the things that have happened in our pandemic have really put a spotlight on viral respiratory infections, which include flu and COVID-19. Some other myths that we have, I didn't get a flu shot last year and I didn't get sick. Well, he's lucky then. So even though you may have avoided getting the flu so far, it doesn't mean that you can't get sick. There's different strains of flu that circulate every year, and that's really why we always have to create a new vaccine, because these things change. I got the flu shot last year, so do I need to get it this year? Well, that goes back to what I just said about the fact that the flu vaccine has to be recreated, and the World Health Organization looks at what's happening in the southern hemisphere, such as countries like Australia, what different types of strains are causing most infection, and then they try to create a flu vaccine that would cover those circulating strains. One thing that is a little bit, it is a bit of a hit and miss, is because it takes about 6 months to develop a flu vaccine. So even though it's something that we do on a regular annual basis, it still takes time. I'm healthy, I don't need to get a flu shot. Well, I think there's, things like that. I'm healthy. I get a flu shot, and I get a flu shot because, one, I don't want to get the flu. The other thing is I deal with vulnerable populations. People coming into a pharmacy are coming in usually because they have some sort of comorbidity or other, some health conditions that could put them at high risk. So I don't want to be the transmitter and cause harm to my patients. I also have, my mom is 87 years old, and I don't want to be, around her if I'm going to not be vaccinated. So I think it's a responsibility for all good citizens to make sure that they get vaccinated for the flu. So looking at the flu, it is a very highly contagious respiratory and serious infection. Um, Again, some of this information speaks to the COVID transmission, which I think, again, has just made us more aware of how respiratory viruses spread. And it can be from a cough or sneeze from 6 feet away, and the flu virus can lay inanimate on surfaces from anywhere from 1 to 2 days. So how do we prevent contact? By practicing respiratory etiquette, which I think we know now is the coughing or sneezing into our sleeve, and also obviously mask wearing is going to make a big difference for this flu season, and hand hygiene. So making sure that you're washing your hands with soap and water. And because if you've touched a surface that has the flu virus, you can transmit it to yourself by touching your face holes. That's what we try to tell little kids, don't touch your face holes. So please, it's the mucous membranes that get that transmission. So it includes nasal passages through the mouth directly into the lungs, or even the eyes can be a mucous membrane of transmission of viruses. So people are contagious for about 2 days before they get symptoms, and are usually contagious for about 5 to 7 days afterwards. Now, most people will get well within about 3 weeks, and that's kind of the outlier maximum. People are typically a little bit healthier before that, but it can be as long as 3 weeks, and of course can lead to more serious consequences. And this is just to give an idea of the volume of patients that have influenza and then have to be go to an emergency department, admitted to hospital, or even mortality. So we have almost close to 200,000 emergency visits that are associated with influenza, hospital admissions over 12,000, and then a fairly average fatality over a season is about 3,500 Canadians. And this is for a vaccine preventable disease. So this is kind of where the struggle is. So it's certainly not nothing. I think that if you're paying attention to the news, and I think most people are, you're really looking at the statistics of it and the concern with public health as we go into closed quarters and we go into flu season, as we need to get as many people protected against influenza as possible. So what is the burden of influenza in older adults? So this little graphic here just kind of gives you a kind of idea that for our population, for Canadians that are 65 and older, is only 15%. So the majority of our population is younger than 65 and older. And with that, but when you break it down, 70% of the hospitalizations are in people 65 and over, and 91% of the deaths due to influenza are also in that age group. And every year I'm getting closer and closer, closer. So it's really important for us to appreciate that as we get older, we naturally lose some of our immunity, and actually that starts around age 50, where our immune system isn't nearly as robust as it once was. So this comes into consideration when we look at getting vaccinated. Another thing to make note of is that of the age group of 65 and over, 40 or about 3/4 of people have at least one chronic condition. And those chronic conditions can be things like respiratory, like asthma, or chronic obstructive pulmonary disease, some sort of heart disease, which could be hypertension, or high blood pressure, or they could have high cholesterol, which can impair circulation. And then any of the diseases that are listed on the left side of the slide. So cardiovascular, but also diabetes mellitus, or most people think of it as diabetes, is a big indicator of people that are at a higher risk group. And I have morbid obesity on there, and just to let you know what that means, the definition is 40 BMI or body mass index or greater. Risk factors for influenza, obviously, there is an age component, chronic medical conditions, and like I mentioned on the last slide, the weakened immune system. So what does that mean as far as implications to our bodies? Well, we obviously know that there's respiratory effects, right? We can have exacerbations or worsening of asthma or chronic obstructive pulmonary disease. These respiratory effects can lead to ear and sinus infections, and of course, go deeper down into the lungs and cause a bronchitis, which is inflammation of the lungs, or a pneumonia, which can be either a viral issue, or it can also be a secondary bacterial infection. So these are things that I think most people kind of understand, because it's a respiratory illness, that those are some of the potential consequences. What is less known, and it's less known because it really is only been in the last few years that science has figured out that the infection that a person gets with influenza actually leads to inflammation in the patient's body, and that inflammation can then go on to cause further problems down the road. And this isn't just true of the influenza infection, it's also true of COVID-19. It's true of pneumonia, and it's true of even something like herpes zoster or shingles. People can then go on and get this. Our body's part of its natural immunity is to create this inflammation, and this inflammation then goes on and can have some very detrimental effects on the heart, for example. So on the right-hand side of the screen, it talks about an acute myocardial infarction. That's a heart attack. Ischemic heart disease, so that's things like angina or chest pain. And then cerebral vascular disease, so that can mean things like strokes or mini strokes. So there certainly is some consequences to these types of infections. And through that, it can also exacerbate or make worse anything with kidney issues, and of course, diabetes as well. And I think, again, when I look back at that list, and I'm just going to actually pop back to that. When I look at this list, folks, and working in a pharmacy for nearly 30 years, my patients that come in often have one or two of these, and you just think of just the high riskness of having that comorbidity. And this is I kept this in, I wanted just to give an idea of what that inflammation pathway looks like. And I think this gives a nice outline of that. And so part number one, it says high risk plaque formation. So that's basically, it can be blood clotting cells, or you could, somebody has high cholesterol, and then infections go on to cause this inflammation, and it can affect how our blood circulates. So there's a word, atherosclerosis, which is hardening of the arteries. So already have issues with circulation if the arteries aren't expanding like they should be for blood flow. Then we get a severe inflammation from an acute infection, and then that goes on, and that inflammation can cause plaque rupture, and then you've got blood clotting issues, and it can go on. It says acute coronary syndrome, but it's basically, it can go on to lead to a heart attack. And I just included this one, but those same sort of inflammations can go on to cause other circulatory issues or respiratory issues. So it's really important to appreciate that getting an infection like influenza, like COVID-19, a pneumonia, or even an exacerbation of shingles can lead to this inflammation cascade that can go on to cause, further problems. So just to kind of sum it up a little bit on that, looking at If you have a chronic heart disease, your risk is mortality is 5 times greater. If you have chronic lung disease, then the risk is 12 times greater. And if you have chronic um, heart and lung disease, there's a 20-time fold of bad outcomes with influenza. And another piece that's really important too is the change in our ability to be mobile and independent. And there's some things that happen as we get older. We lose strength and bone density, which again happens around the 45-year mark. And then if we do end up being hospitalized or bedridden, we don't get the same nutrition, and it can lead to being immobile and bone loss and bed sores. And then, again, the nutrition piece and dehydration, people can lose weight, and then medications that they're on might be at doses that are a little bit too high, and people can feel faint, and they can fall and break hips or other bones. And then, the loss of dependency and ending up in-home care or in long-term care, which I think, the majority of people like being independent and doing their program. So preventing illnesses that could lead to these unfortunate lifestyle changes is really, really important. So let's look at vaccines in Canada. What are the recommendations? I've got multiples, efficacy, and safety, because I think some of those things the efficacy and safety of vaccines is sometimes one of those myths that people have. So I just want to talk about that, and the multiples thing will make sense as I go to this slide. So I've included this slide. NACI, up in the corner there, NACI, is the National Advisory Committee on Immunization. So this is a Canadian body that makes decisions on what vaccines should be put on the Canadian market, who are who should be getting those vaccines, so what age cohort, or people with pre-existing conditions or other things that would make them more susceptible to a particular disease. So NACI is the one that we listen to on the province and territories when we're deciding if that vaccine is appropriate for Alberta, because our epidemiology or our diseases can be a bit different from province to province. We've got such a big country, right, that things can be a bit different. But we do look to NACI for information. And shortly after the pandemic started, they put out this information, and just the concern of people not getting immunized. And it was, partly going into our flu season, but it's also for routine immunizations. And I'll talk about a few adult ones in a few slides. But, making sure that kids are sticking to their routine immunizations as well. So what they said about seasonal flu was that it is an ongoing disease, particularly in fall and winter months. Vaccine is the most effective way to prevent flu and the flu-related complications like I expressed. Vaccine is an important component of managing healthcare system capacity during flu season in an ongoing pandemic. And this is something that is really, really important. So this is when Dr. Tam started to discuss flattening the curve. It's along these lines. And with a pandemic, and certainly with COVID-19 being as incredibly contagious as it is, there was an understanding that we wouldn't get away with not having any illness, but what they were trying to do is decrease as much as possible, because our healthcare system could get completely overwhelmed with hospital admissions, ICU admissions. Even now we have a couple of outbreaks at Foothills Hospital that are impacting quite a few healthcare workers who then aren't able to go to work and have to quarantine. So there's certain things that we have to be very cautious about and careful. And then offering immunizations when it can be combined with other medical visits, and offer multiple vaccines if required. So what the idea is to minimize the number of times that people go in to see their healthcare provider. So decreasing, the number of contact points. So, if you're going into the pharmacy to pick up your prescriptions, then you get a flu shot. But then there's also some recommendations for some other vaccines. And like I say, I'll bring that up in a few slides here. So what are the recommendations put out by the National Advisory Committee on Immunization? Well, they have put out two sets of recommendations, and they've done this for both influenza and for pneumococcal disease, or people think of it as pneumonia. And they have one set of recommendations that's is at a program level. So what they're making a recommendation for, in our case, it would be Alberta Health and Alberta Health Services. And then they have a separate recommendation for the individual. And it seems kind of silly. We should have, the recommendations, at least in my mind, should be the same. We deal with a healthcare system that's supposed to provide us with not only good information, but as a similar standard of care. Anyways, at the individual level, their recommendation has been for when we look at, it's called a trivalent vaccine. Influenza has different strains. There's two types of influenza A and two types of influenza B. A trivalent has the two A's and one B. The vaccine choice that we have, which I'll get to in a bit, for our standard routine that you would get at the pharmacy, is called a quadrivalent vaccine, and it has both two A's and the two B's. But we're looking at trivalent because the B strains tend to affect younger children. They don't tend to affect adults as much. So at an individual level, their recommendation is one called Fluzone HD, stands for high dose. So their recommendation at an individual level is for people over 65 to get this high dose vaccine. The high dose vaccine has 4 times the antigen compared to a standard dose. So 4 times the punch, if you will. And this is really important when you're looking at, again, as we get older, our immune system isn't as robust. So if we need kind of a stronger vaccine to generate the antibodies to help us fight disease. So the high dose one, we'll go to this. So this graph shows a gap. And on the bottom left-hand corner, it says greater than 65 years of age, and it gives you a line of vaccine effectiveness. And then the black line at the top is for people 15 to 64 years of age, and there's quite a gap in vaccine effectiveness. And this is really important. Again, looking at the fact that seniors or people over 65 are more susceptible to influenza and the consequences of it, we need to provide a vaccine that's going to give better protection. So this is why the company Sanofi Pasteur went in and created this thing, Fluzone High Dose, or Fluzone HD. And again, has 4 times the antigen. So antigens are the foreign entity that comes into our body, and our body's response is to create antibodies. So if we've got more antigen coming in, we're going to generate a higher level of antibody protection. And what they found was that there was a 24% increase in vaccine protection. And I think this next slide really kind of depicts it in my mind the best. So when we look at the little peoples on the left-hand side with no vaccination at all, and think of 100 breakthrough influenza cases. So 100 people who didn't get vaccinated get the flu. And then the people that were vaccinated with the standard dose vaccine, of that 100, about 30 cases, or 30% of them, would be protected with the vaccine that they received. With the high dose vaccine, that makes an additional 17 people. So the people in the blue there, there's the 30 from the standard dose that would still be protected, obviously, with the high dose one, but there's an additional 17 people that would also be protected. So total, because we're dealing with 100 people, 47 of the 100 influenza cases would be prevented. So that's a 47 protection rate versus about a 30% protection rate that we have with a standard dose vaccine. Of course, none of this is me saying don't get the standard dose vaccine. It is absolutely you need to get a flu vaccine, pretty please. But this high dose actually has better protection. I will also add, though, and it's funny because I had a conversation with my mom today, this afternoon, because she was asking me about flu shots, and I'm in Calgary, she's in Edmonton, so I can't go, I can't drive up there and give her a flu shot. But she was asking me what my recommendation was, and I did say to talk about the high dose vaccine. And she said, is there any side effects? And I said, well, because it's 4 times as strong, it does have elevated what we would consider what we get a local reaction, and a more systemic or overall body reaction. So the high dose does have higher reaction rates than a standard dose, but again, it's your body's immune system kind of combating the inactive vaccine. So most common would be pain at injection site. You could also get a bit of redness and swelling. And then the next ones, Malaysia basically means a feeling of unwell, and malaise kind of the same thing. It can be achy, tired. Headache is another thing that can happen with a flu vaccine. And very rarely do we see fever in either the standard dose or in the high dose vaccine. So that's kind of a rare systemic reaction with that. Here are the other vaccines that I would recommend, and I think it's again a good idea to. I think sometimes people, as we get into adulthood, think that, oh, we got all of the vaccines that we needed when we were in childhood. Well, I can tell you that the vaccine that kids are getting these days doesn't look at all like my vaccine history from the 70s. There's certainly things that have been added on and things that need booster shots. So the first one up is Tdap, or tetanus and diphtheria. I'm sure everybody has heard of tetanus. Tetanus, people think of rusty nails and all of that, but tetanus is a bacteria that lives in soil. All right, so we can get it from anything like that, and it's universal. So there's no place in the world that doesn't have a tetanus risk. Diphtheria is a respiratory illness, very rare in Canada, although we did have a case in Alberta a few years ago. But the recommendation is to get a tetanus and diphtheria shot every 10 years, okay? So if it's been more than 10 years, it's something to consider. And the other piece of that, pertussis, which is whooping cough, is another vaccine that is recommended to get at least once in your adulthood. So if you've never had a pertussis or whooping cough vaccine in your adulthood, it's a good idea to get one. And having whooping cough when you're a child doesn't give you long-lasting immunity to it now. The other thing is people think of whooping cough as only being significant in infants, but you can be a transmitter. And so the recommendation is actually a pregnant woman should get this particular vaccine with every pregnancy, but there is also a recommendation that anybody that's a household contact or a grandparent who's going to be, visiting the baby should also be vaccinated against pertussis or whooping cough. So Tdap is one that I would recommend. The next two are both pneumococcal pneumonia shots, and this one often leads to some confusion. There's one in the word polysaccharide. It's a type of vaccine. It's how it's manufactured. And polysaccharide vaccines are fairly weak vaccines. They don't get deep into the immune system. But this one has 23 types of this particular bacteria that it works on. So it's still recommended. And if you're 65 and older and haven't received this Pneumovax 23, then you can go to your pharmacy and they can provide it at no charge. It's part of our are routine immunizations for people 65 and older. The next pneumococcal vaccine is in a conjugated form, and it's just a little bit stronger. It's got a protein added to it, which provides a more robust immunity. So it goes deeper into the tissue and lasts for a longer period of time. With this, it only has 13 types of the bacteria in it, so it's not, doesn't have as many types, but it's a stronger vaccine, works longer, works better, and it's recommended for people with certain medical conditions, and I would actually recommend it for most of my patients. And in fact, I've been vaccinated with that. It's called Prevnar 13 in about mid-March, when the whole, we were having a pandemic that has a respiratory component. I thought I would best to get that particular vaccine for myself. Again, so that one's called Prevnar 13. And herpes zoster or shingles is a vaccine that's recommended for anybody who had chickenpox as a kid, which is most people now. And you can get that as early as 50 years of age, and it's a 2-shot series now with an inactive vaccine. All of these inactive vaccines are safe and effective, and they can be given at the same visit. So if you need to go and get your flu and, pick another vaccine or two that you would like to get, or you think is appropriate at this time, it is a good consideration. And again, a lot of these have a respiratory component, like whooping cough and the pneumonias, where you really want to protect your lungs as best you can, particularly in this time of a COVID pandemic. And I'm not going to spend a huge amount of time, but one of the things that I wanted to talk about is the safety of vaccines and medications in general. And just to get a sense of, it takes a long time for things to come to market in Canada. It's not an overnight thing. It takes a lot of research, clinical trials, and those can take years to do. So just keep in mind that when listen to our public health officials, these are the people that know what they're talking about. That we, it was very hopeful that we would have a COVID-19 vaccine in a year to a year and a half, and that's on the more realistic side of anything that is getting spouted saying that it's going to be any sooner than that. The good news piece on a faster COVID vaccine than what would be traditional for most vaccines is the fact that we've got the entire world working on this. And there was work and research into the original SARS infection. If you guys remember, it predominantly affected, in Canada anyways, Toronto area, and that was back 2003. There had been research and study of a SARS, it's called SARS-1 vaccine. So that research got stopped, unfortunately, when SARS didn't turn out to be the big pandemic that was feared, but there was still some research and a little bit of groundwork that had been done. So hopefully that kind of comes into play with our COVID vaccine. All right, so some changes that we might be seeing when we are going to the pharmacy. If you guys are on any medications, you've probably already been into your pharmacy. I know that a lot of pharmacists in my world are doing more deliveries and things like that, just to keep it for people not having to go out into the germy world. So some reassurance of where to get your flu shots. So where do most people get their flu shots in Alberta? Well, 61% of all flu vaccines administered last season were done in a pharmacy by the pharmacist. And that number has increased by about 5% every year for quite a few years. Pharmacists, our first year of giving flu shots through the public program was back in 2009, which was also the year that we had the H1 pandemic. So pharmacists have been providing influenza vaccines for over a decade now. Just to give you a sense of immunization rates, and this is the overall immunization rate. It's not necessarily broken down into different age groups. But last year we got, pardon me, It's just water, folks. Last year, 32.9% of Albertans, so let's call it 33% of Albertans actually got a flu shot. And that's actually an increase by about 2% from the season previously. And again, from word of mouth from my pharmacist colleagues, they said that they did see, as March came in and the pandemic came in, people were quite keen on getting that seasonal flu shot that they didn't get, earlier in the season, like October, November. So there was a bit of a push for that. And by all estimations, I think that we will have a lot of people interested in getting a flu vaccine this season. Again, trying to protect ourselves as best we can with a vaccine preventable disease, so that we're not, compromised or immunosuppressed, make us more susceptible to something like COVID-19. So this is a lot of information on one slide, so I'm going to read it aloud. So looking at the recommendation for us in Alberta, it's a quadrivalent vaccine. Again, it's got those 4 different groups. It's got 2 influenza A's and 2 influenza B's. The high dose vaccine, though, the one that I'm recommending for you folks, the Fluzone high dose, is actually getting provided in all long-term care facilities in the country. This is a first, and it's provided by the Government of Canada. They're funding this program. So it's a federal program, which is very unusual. Our flu, or not our flu, just our immunization programs are done at the provincial and territorial level as far as making recommendations and covering costs. But this is a unique situation where they, I think we saw such devastation in our long-term care facilities with COVID-19 that there was a real push to do something, something right. And so people that are in those facilities will be able to get Fluzone high dose at no cost to them. The NACI recommendation, again, is for the high dose trivalent over standard dose trivalent. The publicly funded vaccine is a standard dose quadrivalent vaccine for 6 months and older. So if you've had your flu shot last year, the year before, it is the same vaccine that we've had, of course, fine tweaking to the different strains of flu, but for the last few years, we've had what's called a quadrivalent, or the 4 type vaccine on the market, and that's what you would have got at your pharmacy. The Alberta program starts on Monday, October 19th. If you want to get Fluzone high dose, it must be ordered in advance. So if you're interested in getting this vaccine, you'd need to phone your pharmacy and make a request, and they have to order it from the vaccine manufacturer. So my recommendation to my mom today was phone your pharmacy and ask if they've got Fluzone high dose. And from what I understand, the vaccine is, if you ordered it a week or 2 ago, it's actually getting shipped, if not this week, then next week. So there's even an opportunity to get that flu shot before the October 19th launch, where everybody else will be getting in queues to get in there. So again, expected in early October. There is a cost to it, and that's kind of the unfortunate thing. It is with the 4 times the antigen, it does cost the manufacturer significantly more to produce it than it does for a standard dose vaccine. So the cost coming into the pharmacy is probably around $60-ish. There is some sort of upcharge and maybe an injection fee. At the most it should cost you would be $100 for everything. And I appreciate that is, $100 is $100. It is not covered by Alberta Blue Cross Seniors Program, Group 66, as some people know it. But if you do have, coverage from work, post-retirement from work, then there might be some coverage in that. And again, it to me it's an investment into a better vaccine product in an age group which is more susceptible to flu, more susceptible to the negative outcomes of it. I think it's worth the investment. So regardless, though, if it seems like it's a bit too costly or what have you, and you want to get the standard quadrivalent vaccine, just kind of keep these things in mind as you're going to the pharmacy. I know, again, I've got some colleagues that have always had, they've had more walk-in traffic for flu shots than they do for appointments. But I would really try to emphasize to everybody to try to do an appointment-based one. That means that you'll be seen in good time, and you're not going to be waiting and waiting and waiting. So setting up appointments, I think, is the best practice for going through this pandemic. And arrange for transportation. So find a day that, you know, if you do need somebody to drive you there, that you guys schedule that in advance. Discuss getting multiple vaccinations. So again, those vaccines that I recommended, things like the tetanus, diphtheria, and whooping cough vaccine, or your shingles vaccine if you haven't had it, and then those 2 pneumonia shots. And I don't mean that you want to go and get 5 jabs in one day, but you know, maybe look at your vaccine history and consider 2 or 3. If there's any opportunity to fill out a consent form or anything that you can do in advance to going to hopefully your appointment to get a flu shot, please do that. The less time that you spend in the public, in the pharmacy, the better. And again, pharmacists that I know will be wearing, they're wearing masks now, but they'll be wearing a mask and likely either a pair of goggles or a face shield when they go to give you your immunization. Please wear a mask when you go. It is our regulations, at least in Calgary, to wear them in indoor public spaces. But wearing a mask, and if you don't have a mask and one is offered, please use it. And the other thing is to have as little conversation as possible. And when the pharmacist is giving you an injection, just to look away as much as you can, so that when you're breathing, you're breathing in kind of the opposite direction. So just as a caution for yourself sitting in the injection chair, and for the pharmacists as well. And please wear a short sleeve shirt, something that can be pulled up to the top of your shoulder. That's one thing that people often forget. And the problem, again, with this season being so unusual, is that it's just going to be another rate limiting step. We want to get this done safely, but as quickly as possible. So if you remember to wear a short sleeve shirt, then it's an easy pull up to the top of your shoulder, and the pharmacist can administer the vaccination. If you end up having to, take off some clothes, whether it's a sweater is fine, but if you're having to kind of disrobe, then the doors have to be closed in the injection rooms, and certain other things that we're really trying to avoid as best as we can. So and again, this is something that was put out by Alberta Health. Just as a reminder, and I'm sure if you've had a flu shot, you're familiar with post-influenza. So after your flu shot, the side effects that you tend to get are mild. They usually develop within the first day and maybe last a day or 2. Common ones that match a lot of symptoms of COVID-19 include fever and chills, a sore throat, a cough or runny nose, feeling tired, headache or body aches. So we're really looking for people to identify these symptoms, because they could be side effects from the immunization, or they could be symptoms of COVID-19. So if you experience any of these reactions within that 24, 48-hour period, you're supposed to monitor yourself. If you develop symptoms, you should stay home. So even if you're not sure whether it's a vaccine or if it's COVID-19, you're to stay home. If the symptoms resolve within 2 days of when you got them, you can return to normal activities. If they last longer than 48 hours or a couple of days, then, and if you have any pre-existing conditions of concern, then you should follow up with HealthLink at 811, or go online and do the self-assessment tool. So this is new. And again, I think if you have a little bit of warning that this is something that, that we have to be aware of, you can schedule your appointment, knowing that if for the next 1 or 2 days, that if you do get any sort of side effects from the vaccine or potentially COVID, that you would be able to, you're not going to be having to cancel appointments and do other things. So give yourself a couple of days after you would get your typical flu shot to see if there's any issues at all. And then lastly, just in conclusion, what we're really trying to do is increase immunization rates. So the more people that get vaccinated, now everything, you know, a lot of these little terms that I've known for a long time are very familiar to everybody now, things like herd immunity. The more people we get vaccinated in our herd, the better protection we have against disease. And the other piece of that is using the best vaccines that we can. So we have wonderful vaccines and wonderful vaccine programs in Canada, but we want to use, in the case of people over 65, if at all possible, to use a high dose vaccine. The person is going to have better coverage and decrease their risk of disease and even transmitting the disease to somebody else. And that's all I've got.
Thank you so much, Betty. Honestly, I will say that truthfully, there's many learnings for myself. And I think that myself, I've had a career in healthcare, and we think that we sort of know everything, but it looks as though I don't. And I just wanted to share with everybody here this evening, I didn't really understand about the inflammation that you described earlier on. And so I really appreciate that, because many people speak about how they got the flu, but it took them months to get over it after. And so that was really interesting for me. And also, your tips were excellent about planning your visit to the pharmacy and trying to make that as strategic as possible. I think that that's really sage, wise advice. Making sure you have that short sleeve. When you're in the chair, look away, make sure that you have your mask with you. And all those tips just make it less stressful, you know? When you're planning and you're looking forward to getting to the pharmacy and you get there and everything's a bit of a jumble, it really doesn't make the visit, I guess, pleasant when you're just trying to do something nice for yourself. Right. So Betty, we do have a couple of questions. And sure. One of the questions was, after a certain age, do you need to repeat your pneumonia 23? Do you need to do that again, Betty? Okay, that's a fantastic question. So the pneumonia 23 shot is, if you're younger than 65, you may have got it if you have a certain pre-existing condition. So if you have COPD or chronic obstructive pulmonary disease, diabetes, you may have already received it. And then you'd still receive a dose at age 65, as long as there's a 5-year gap. So if you got Pneumovax 23 when you turn 61 because of a pre-existing condition, you would wait 5 years to get your 65-year-old dose. Once you've had that 65-year-old dose, there is no need to get any further doses of that. And actually, with that polysaccharide vaccine, it's a weaker vaccine, and there's some caution that giving multiples of a polysaccharide vaccine can actually decrease the immunity. It's kind of a weird thing. Okay. So you should get, you know, for sure at that age 65, you'd get that shot as long as you don't have conditions that would require you to get it when you were under 65. Thank you. Another question that I received was, why is there the myth that a flu shot would be bad for you? People think that getting a flu shot is bad for you. Is there anything that could possibly be happening to you when you get your flu shot that could be taken as being bad for you? No. No. Okay. But I'm a scientist. There's this sort of hero mentality out there that I'm not going to get it and it's not good for you. But yeah, really, I think, you know, like, again, there's a lot of there has been a lot of misinformation and some really, you know, detrimental things that are not based in any science at all. And I'm a scientist, so I don't know. I know I've had some people talk to me about the fact that they feel that that it's better for their own immune system to produce antibodies against
disease.
Mm.
But really, on all honesty, some of those things, some of the diseases that we're preventing can cause great harm even before we produce our own antibodies, like
That's right. And
meningococcal
so that's why
meningitis.
this inflammation, right? That can leave lasting damage.
Yes, it absolutely
Yeah.
can, and
Yeah.
I've seen it firsthand
Yes.
with my favorite aunt who
Hmm.
got a bout of shingles, which created inflammation, and then
Right.
subsequently she had a stroke. So
Betty, the other question I got was, is there a cost to go get these booster shots? Like I know that you lump them together, but I know shingles, there is a cost to that. Is there a cost to other booster shots?
Um, it depends on where you go. So the Pneumovax 23, you can get at once you turn 65, you can get it at a pharmacy, some
Okay.
family physicians, and this is it's I can't say free because I'm not supposed to say it. I'm supposed to say publicly funded.
Publicly
So you pay
funded,
zero.
Betty.
Yes, publicly funded.
Publicly
So
funded.
you don't pay for
Taxpayer
that
dollars
one.
at work.
Yes.
Yeah.
So you can get at that 65-year-old dose at a pharmacy. Some physicians carry it, and a public health clinic would have
But
it. So
before
that's no
that, do you pay a
charge.
little? Do you pay a little before you're 65?
Yeah, if you got that vaccine before you were 65 and didn't have
Uh-huh.
one of the pre-existing conditions
Okay.
that allows it, it's a very inexpensive vaccine.
Okay.
But the Prevnar 13 is, again, there's some conditions that would be covered publicly, but other than that, it is a cost of about $130,
Okay.
$135.
So
And
what
then
happens if
shingles
you
is a
can't
cost.
remember really what you've had and what you haven't? Like if you're sort of a new senior and you're just, in your low 60s and you went through the public school system and you had your vaccine, probably then if you're creeping around 61, 62, it's probably a good idea to get boosters. Did we understand that correctly?
Yeah, yeah. And the other thing, if you got a vaccine through a
Yeah.
public health clinic, or even family physicians, and recently pharmacies, a pharmacy actually can bring up your vaccine profile,
Oh,
but
okay.
only for the ones that you got through a publicly funded program. So if you went to a
Right.
travel clinic, they won't be able to access what you got there. But if you got your pneumococcal shot at your physician's office, they should
Uh-huh.
have some record of it there too.
And your
But yeah,
childhood vaccinations, right? So it's
yeah,
maybe a good time to just remember those people who've joined us this evening, how we sort of keep track of those things. Get a little shoebox and make sure you keep track of what you've done so that you can keep track of that. What was the other? Oh, is there any concerns? Like, why would you get a headache from your flu shot? What is causing that headache? Is it just because that's just a general side effect? What's the headache about?
the headache is just like any of the other kind of systemic issues or things that
Uh-huh.
happen in our body. It's our immune system going, hey, there's something foreign in here,
Oh,
and it's
okay.
just a reaction. So headache is something that we would like to get with influenza, the disease. So it's not unusual to get similar type reactions to a much lesser degree, though, to vaccine.
And with those symptoms, what would you recommend for folks? So then I think we all accept that we do get some side effects, and I have had a flu shot. What do you recommend for people? They need to understand what other medications they're taking, but just in general terms, would you go home and take an Advil, or what would you do?
I would ask their pharmacist.
Ask the pharmacist.
Yeah,
Okay,
their
yeah,
pharmacist will have their list of medications. So if they're on medications that are blood thinners or anticoagulants, they
right,
shouldn't be taking something like Advil necessarily.
yeah,
So it's really important to ask your pharmacist. And again, that would be a better question to ask before, like when you're scheduling your
right,
appointment, so that the pharmacist can do that research. So you're not sitting there waiting for
yes.
the answer. So can
Betty,
you please
that's
take
such a good idea. Let's add that to the checklist.
yes,
So
but
when you
the
go, you've
big
got
old
your
checklist.
checklist.
Yeah. And as far as like, I think most people feel a little bit of discomfort in their arms. You can always
Yeah,
go home and put an ice pack on it for 15 minutes, and that
right.
sometimes helps with the soreness and the
It
swelling, and
does.
that
A little
certainly.
bag of peas. I think
Yeah.
that works nice. I always get a headache. Nothing else. My arm's fine, but I get a headache. And so I just understand that I need to have a quiet time, and that's what things are going to look like. So I
Yeah.
think that that's all our questions that I received. I do really want to thank you though, Betty. That was very informative, and I like the way that you used the graphics as well. That really helped us move through the process. So thank you very much. We're also recording this presentation, and we will be posting this and sending out a questionnaire afterwards. For everybody who's with us this evening, we have some follow-up questions for you, so it will help us with some presentations later on this year. So thank you, Betty. For those people who would like more from Calgary Seniors Housing Forum Society, we are featured 6 times a year in the Calgary Herald. Our next edition is coming up on October 26th. And I would like to invite you to follow us. It comes at the last Monday every 2 months. And then also we will have further Zoom webinars, and we'll be sending in our, excuse me please, our inserts will always add an ad about when our next webinar is coming up. The topic of our next insert in the Calgary Herald will be, what is it like to be in retirement living now? Can you go and tour them? What's it like if your mom has to move into long-term care, or your dad? What's that process going to look like now? You can follow us on Facebook, or if you have any questions, there's the email address at the bottom. Lastly, just because COVID-19 has been hard on everybody, and I just want to make sure if anybody out there is feeling isolated or lonely because they've spent more time at home, please reach out to your family and friends, or maybe even a healthcare professional. Don't suffer alone. Your mental health is important, and there is a phone number at the bottom. Please copy it down, because this too shall pass. We are together in this, but sometimes these things hit other people harder, and you need to seek out help. And let's all be positive and join hands in our well-being. Just our last slide is thank you to everybody who joined us. I would like to just say thank you to all our sponsors, and thank you very much, everyone.
Yes, thank you for having me.
You bet. Thank you, Betty. Bye for now.
Bye-bye.